Welcome to today's video where we'll be diving into the world of flight nursing. If you're gearing up for an interview for this exciting role, you're in the right place. Let's kick things off with our first question, which is all about leadership in high-stakes situations. Can you tell us about a time when you led a medical transport mission? What were the challenges, and how did you tackle them? Interviewers ask this to assess your leadership skills and how you handle complex situations. Here are some tips to help you craft your answer. Choose a specific mission where you took charge. Highlight key decisions you made and their impact. Discuss challenges like weather or equipment issues. Explain how you resolve these challenges. End with the positive outcomes of your leadership. Now, let's look at a sample answer to give you a better idea.
On a recent transport, I led a team moving a critically ill patient from a remote area. We faced severe weather that impaired visibility. I quickly evaluated alternative routes and worked with ground and air support to find a safe path. By making real-time decisions, we successfully transported the patient without delay, ensuring they received timely care.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for Flight Nurse. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Could you share an example of a conflict with a team member during a mission and how you resolved it? This question is designed to evaluate your conflict resolution skills and your ability to work harmoniously within a team. Let's go through some guidelines to help you formulate your response. Identify a specific conflict during a mission. Briefly explain the differing perspectives involved. Describe your approach to resolving the issue with a focus on communication. Emphasize the importance of teamwork in your resolution. Conclude with the positive outcome and what you learned. Let's take a look at how you might answer this question.
During a critical transport, a colleague and I disagreed on the patient's treatment plan. I approached them calmly, listened to their concerns, and shared my perspective. We compromised by implementing a joint approach and consulted our medical director for final advice. The patient received optimal care, and it strengthened our teamwork.
Can you describe a high-pressure situation you faced as a nurse and how you managed to stay calm and effective? This question aims to assess your ability to manage stress and maintain effectiveness under pressure. Here are some pointers to keep in mind when crafting your response. Think of a specific high-pressure situation in your nursing experience. Describe the scenario clearly without unnecessary details. Explain the steps you took to manage the situation effectively. Highlight how you maintained your composure during the pressure. Conclude with the positive outcome or lesson learned. Here's a sample response to help you out.
During a trauma case in the ER, we had multiple patients arrive at once. I quickly assessed each one, delegated tasks to team members, and focused on the most critical cases first. By staying organized and calm, we stabilized the patient successfully.
During transport, you realize that your medical supplies are running low. How would you prioritize and use what's available to ensure the best possible care for the patient? This question evaluates your resource management skills and ability to prioritize under constraints. Let's review some strategies for answering this question effectively. Assess the patient's immediate needs based on their condition. Prioritize supplies that address life-threatening issues first. Use multi-purpose items effectively, maximizing their utility. Communicate with your team about the situation and available resources. Document any limitations and decisions made for future reference. Here's an example of how you might approach this situation.
I would first check the patient's vital signs and identify any critical issues, such as airway or breathing problems. Then, I would prioritize oxygen and airway management supplies to stabilize the patient, ensuring they receive breathable oxygen. Next, I would use IV fluids for hydration if necessary, keeping in mind any multi-use supplies like IV lines.
If you were transporting a patient from a different cultural background, How would you ensure that you respect their customs and beliefs during care? This question is to evaluate your cultural sensitivity and ability to provide respectful care to patients from diverse backgrounds. Let's look at some tips to help you prepare your answer. Research cultural customs prior to the transport when possible. Use a translator or cultural liaison if there's a language barrier. Ask the patient or family about their cultural beliefs and preferences. Be observant of nonverbal cues that may indicate discomfort. Document any specific cultural needs in the patient's record. Here's a way you might respond to this question.
I would first research the patient's cultural background to understand their specific customs. During transport, I would ask them or their family about any particular beliefs that I should be aware of to ensure I provide respectful care.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.